Measures to increase graft survival, hair growth and hair quality. This is the topic I had presented in the International Society of Hair Restoration Surgeons World Congress in 2018 at Los Angeles. Nothing to disclose. To improve graft survival, hair growth and quality, effort and care is needed at all steps of hair transplant, starting from pre and post transplant medical treatment, minimizing trauma to follicles during harvesting, graft handling and implantation, and preventing dehydration injury and storage injury. So, to improve the final outcome of hair transplant, we need to reduce operative time, to reduce ischemia time, that is out of body time, to minimize storage injury and reperfusion injury, and to minimize injury to follicles while implantation. Now, to reduce operative time, we perform Buddy's technique of extraction and implantation, that is, two persons simultaneously doing extraction and implantation. Another important thing is use of good quality punches. Then we have to take care of ergonomics to reduce fatigue. This is the video showing excision. This is the donor area and you can see two surgeons are extracting graft simultaneously. One is right-handed and another is left-handed. So one is taking graft from the right side and at that time other person is doing from the left side and vice versa. So you can see very comfortably two surgeons can extract the graft and this reduces the extraction time just to half. Here two technicians, they are doing implantation simultaneously and at most of the center in the world two persons are doing simultaneous implantation. One is again doing it with the right hand and one with the left hand. So with practice, you can do implantation with the left hand also. Now to reduce ischemia time, that is out of body time, simultaneous excision and implantation and two-person technique of follicle harvesting. This is known as Buddy's technique of follicle harvesting and Buddy's technique of implantation. We have already seen the video. Then the third point is small sessions of extraction and implantation. That is, extraction period should not be more than 1 hour. So combination of all these reduces harvesting time, graft out body time, implantation time and patient doctors and technicians fatigue and fatigue related factors. This is the video showing harvesting from the chest. So chest grafts are harvested. You can see delicate chest hair grafts. Again, two surgeons are extracting at the same time from the right side and another from the left side and one technician is implanting the grafts. So it helps in reducing the out of body time and 30 to 40% of the graft they are implanted at the same time while excising the graft. Now to minimize storage injury and reperfusion injury, we use platelet-rich 3D fibrin scaffold as an autologous graft holding media. The study done by the author proves that graft survival in plasma is up to 72 hours. The hair density and hair thickness is much better in plasma as compared to the normal saline or ringer-lactate, and also there is early hair growth. This paper is published in Hair Transplant Forum International in 2018, volume 28. It is also presented in the World Congress of International Society of Hair Restoration Surgeons in 2016 and 2017 and in 2018 in World Life Surgery Workshop. So here is the video. You can see blood is collected. We take 50 ml of blood. This blood is kept in two test tubes. Then the plasma from the one test tube, you can see, is used as graft holding solution. We keep graft in them, so a gel is formed. A fibrinous gel around the graft prevents them from the ischemia and from the dehydration injury, and these are implanted by the no touch to root technique. This is the schematic diagram for preparation of plasma as a graft holding solution and for the preparation of PRP. So you can see in the syringe, we use 50 ml syringe, 4 ml of acid solution as an anticoagulant is taken, and then blood is collected, and this blood then we sent for first spin in the centrifuge machine. Plasma is after centrifugation we get the plasma. For the first test tube is used for the graft holding solution. Plasma from the first test tube is used as the graft holding solution, and you can see these are the grafts and they are covered by the fibrinous gel. And from the other test tube the plasma is taken for the second spin, and this platelet plug is formed, and after the preparation of this PRP we inject it into the recipient area. Now prothrombin, when comes in contact with tissue collagen, it gets converted to thrombin, and thrombin converts fibrinogen into fibrin. Fibrin is a fibrous non-globular protein. There are fibril strands which form a network in which RBC and or platelets get trapped to form a clot. You can see. Now when grafts stored in plasma and ring-elected were sent for histopathological examination by MTT stain to see live hair follicle, we can see that live cells are well stained in the plasma even after 72 hours, while very poor staining in the ring-elected. When we take hair density by the trichoscan, we can see that anagen effluvium is much less on the plasma side as compared to the side of ring-elected. So, hair density at 3 months on ring-elected side and plasma side, we can see that hair count and density in plasma group was significantly higher than ring-elected group with p-value of 0.001. When we take thickness of the hair with the help of trichoscan, thickness of the implanted grafts, when they grow hair, thickness of this hair is much more as compared to the grafts which were kept in the ring-elected. So the hair thickness in plasma group at 6 months was significantly better with p-value of less than 0.001. Now to minimize injury to follicles while implantation, we use no touch to root technique. Implantation is very crucial part. During implantation, graft suffers microtrauma, which causes injury to delicate matrix cells, and final thickness of hair shaft is affected. We use no touch to root technique to implant, in which only epidermal end of hair follicle is touched and the bulb is not touched at all. So, it helps in preventing microtrauma. Our grafts are also surrounded by 3D fibrin scaffold which protect them from dehydration injury. This has significantly affected the hair quality of the implanted hair. Here is the video demonstrating no touch to root technique. So you can see grafts is grasped with the help of the epidermal end or hair shaft, and then it is accommodated by the beveled end of the needle and slide into the hole created by the needle. So this is the implantation by the surgeon. So pre-made sites are not created. Then advantages of all these steps are reduction of post-operative anagen effluvium and shock loss, early hair growth, increase in total yield of number of hair, that is hair density, and thickness of hair is better. The above facts have been proved histologically by trichoscan studies and by global photographs. Here you can see the results. This is the patient in which 3416 grafts were implanted by mixing some of the beard grafts in single day, and you can see the result. Similarly, so these are the results So by taking all steps to increase graft survival, hair growth and hair density, you can see the results are very tremendous, very good. Thank you.